Diphtheria is a very important topic, and in the diphtheria, the two important things are lab diagnosis and prophylaxis. Okay, prophylaxis means vaccine, because you know a lot of children are giving diphtheria toxoid, right? Diphtheria vaccines are given. So let's get a brief idea about diphtheria. Diphtheria is caused by the bacterium Corynebacterium diphtheriae. It looks like this. The bacteria looks like this. They are this is in the gram stain and this is the Albert stain. So just note that they look like Chinese characters, like L and V shape. Okay, let me write that here. They look like Chinese characters or L or V shaped. Okay, they are gram positive bacilli. Okay. And one more thing you have to write is, at the end, you know, they have metachromatic granules. They have metachromatic granules, Remember, Corynebacterium diphtheriae, the bacteria, they have metachromatic granules at the end. You can see in Albert stain, very clearly you can see the metachromatic granules. They look bluish black. Fine. They have a lot of other names, but I'm not going into so much of details because our intention is to make you pass. Now let us move on to the pathogenicity and clinical manifestations. See, diphtheria is causes toxemia, okay, because the things that is toxin mediated. The bacteria are non-invasive. Okay, the bacteria themselves are non-invasive. Same thing you have seen in Vibrio, remember? Vibrio are also non-invasive. So even diphtheria non-invasive, but only the toxins spread. Okay, bacteria are non-invasive. They remain in the local site, that's the pharynx. Bacilli are non-invasive. However, they remain in pharynx. They remain in the pharynx, and the toxins spread via blood. Okay. So there are different types of clinical manifestations. Let me tell you that. In clinical manifestations, diphtheria. Okay, clinical manifestations, you have respiratory diphtheria. Diphtheria. Please note the spelling, diphtheria. Okay, diphtheria. Diphtheria. Just note the spelling correctly. Diphtheria. So you have respiratory diphtheria, cutaneous diphtheria, and you can have systemic complications. In respiratory diphtheria, you will have what? Tonsils and pharynx, okay, are most common sites, followed by nose and larynx. Okay, so you can see in this case there is a pseudomembrane formation. Okay, and here you can see the bull neck appearance. So what happens? The pseudomembrane, it will start blocking the airways and it may result in fatal airway obstruction. Okay, so basically airway obstruction can happen. Okay, I'm telling you just to tell you what exactly the patient will come with. Cutaneous diphtheria, you will have necrosis, punched out ulcerative necrosis, punched out ulcerative, this one, punched out ulcerative lesions or lesions with necrosis. It's not toxin mediated, it's the organism itself. Look how horrible it looks, right? Punched out ulcerative lesion. As soon as you see this, you should say diphtheria, diphtheria, diphtheria. Okay, as soon as you see the pseudomembrane, diphtheria, diphtheria, diphtheria. Fine. Systemic complications, let us see. There could be neurologic manifestation. There could be myocarditis. Oops, it's affecting a lot of things. Polyneuropathy and myocarditis are late toxic manifestations of diphtheria. Okay, other complications can be pneumonia, renal failure, encephalitis, cerebral infarction, pulmonary embolism. So everything on earth actually, right? So let me just add here pneumonia. renal failure, encephalitis, that is again neurological manifestation, cerebral infarction, pulmonary embolism. So don't worry much about these systemic complications, okay? I just wanted to tell you what exactly the patient will come to you with. And I wanted to tell you one thing, if there is a cutaneous diphtheria, you will have to use this portion, okay? You'll have to extract the specimen from here, okay? What else? So you will have to use skin specimen, okay? For cutaneous diphtheria, you have to use skin specimen. So lab diagnosis we will see in next video. Come back in the next video to watch this.